welcome to our virtual session from InfoEdge. My name is Karolina Hachulska and I'm a director at InfoEdge, a boutique consultancy. I'm focusing on customer experience practice. So basically that means that we work with our clients to help them grow their top line or their bottom line via stellar customer engagement strategies. I very frequently work with organizations in the healthcare space, in providers, payers. Hence, this will be our focal point for this session. Today, I'm joined by Adnan Lawai, CEO of Folio3. Adnan, welcome to the show.
Thank you. Thank you, Carolina.
Awesome. Yeah, I'm really happy you could join us today. If you could tell us, a few words about yourself and Folio3, that would be great to start.
Sure. So I'm Adnan Lawai. I'm the CEO and co-founder of Folio3. We're a software development and professional services company. We believe that every business today is a digital business, meaning that every business needs digital components, technology to help it, grow and scale. And so there's three things that we do for our clients, which includes lots of clients in the healthcare industry. We help our clients build, which means that we help them build offerings using our products, using our software development services. We help them sell, which means that we implement e-commerce and CRM and digital marketing. We deploy those services for our clients. And we help them scale, which means that as they go from small businesses to medium-sized and larger businesses, we put in place the software tools that are necessary, things like financials and ERP, and in the case of healthcare, things like practice management solutions and telehealth and so on. I'll be talking a little bit more about that down the line. I'm also one of the founding members of Mentors Fund, which is a seed fund. We invest in early stage companies, and there's actually several companies that we've invested in that are looking to take advantage of some of these very powerful currents and trends that are sweeping through the healthcare space today.
Okay, so actually let's start about the trends, because I think this is a very exciting topic and you're definitely immersed in it. So the first thing that I'm thinking about the trends happening in healthcare is by far the telehealth. So it's not a new trend. It's something that's been growing on in the past few years, but it feels like COVID-19 put the kerosene on the or gasoline on this fire, and now it really exploded. I remember talking to some health executives, late last year, early this year, and they were literally bragging and very proud of that their health system realized 70 or 80,000 televisits in 2019 alone. And it did sound impressive back then,
yes.
But quite honestly, right now it's a volume of 1 week or 2 weeks, right?
Yes.
Yeah. So I'm definitely seeing that, we are all sheltering in place. No one wants to go nowhere near health clinic where we can potentially be exposed to somebody sick. So I think this is one of the trends that I'm seeing here. And another thing that I think will only grow on this telehealth trend is I'm thinking that more and more organizations are beginning to reach patients exactly where they are. So really remote care. A few weeks ago on our InfoEdge podcast, we had a guest from Kaiser Permanente, Nick Arsino. He was presenting, this wearable-based cardiac rehab program. And the results of the program were just absolutely amazing. So, obviously life saved, which is incredibly important. But on top of it, people were so satisfied. They had the patient experience was great. So they were mentioning that not only the program was meeting them where they were, but they were also, it felt that this program, this remote care is actually fitting better their lifestyle, fitting better their, daily duties and responsibilities. So I see things like that happening, everywhere. I'm pretty sure you have some good examples of this as well.
Yeah, absolutely.
Yeah.
Absolutely. I think telehealth and remote care are two huge trends and current sort of, sweeping the industry. And they've been accelerated massively by COVID, right? I mean, as you said, 70, 80,000 a year. Now, you probably have that within less than a week, right?
Yeah.
The other thing, and I think in particular around remote care, the other thing that we're seeing, which is a big trend, which has kind of been cooking for a few years, but I think will get a big boost, is digital devices for healthcare, right? And what I mean by that is software and hardware for management of chronic conditions, right? So, for example, we have a client that we've been working with for the last, more than a year. There are a couple of very sort of well-known, nationally known doctors that focus on Alzheimer's disease, right? And so they've come up with this plan called the Neuro Plan, which, as the acronym kind of implies, focuses on things like nutrition and exercise and unwinding and so on, right? And so we've converted that into an app that people can use. And the app basically, if you take that, it helps you assess, what stage whether you're just at risk at this point or, what stage of Alzheimer's you're at. It helps you set goals and a plan to improve, and then it tracks, right? So, it's integrated with various devices, and you can track your, your nutrition and exercise data and so forth, and it helps you track, right? And, there are clinical studies that are happening right now where, so far the data that's coming out is, shown a fairly dramatic improvement in terms of, people using this plan, using this very sort of usable format.
Yeah.
A big success that we've seen, recently, I mean, I'm sure a lot of you who've been following the digital health space know about LiveOnGo. LiveOnGo is a company that we work with. We helped them build their software platform, some time ago. And they offer, a device and a service for chronic care of diabetes patients, right? And this is a big trend that we see is that, for chronic care in particular, remote care and telehealth, a lot of remote makes a lot of sense because you don't want to, drag the patient into a clinic for every small thing, right? And so, devices like that are, taking data, on a daily basis maybe, or even more frequently potentially, and delivering those to the caregivers. And the caregivers can provide very specific input and feedback as to what to do, just given what's happening with sort of, these measurements that are coming from the vitals from the patient, including things like, the weather, allergen information, et cetera, right? Another example of digital devices in particular, this is one of my favorite examples, is a company that we've invested in from Mentis Fund. It's a company called Iris Vision. It's a really cool company. There's, I think, about 20 million patients that in the US alone that suffer from low vision, right? Now, these are people who were typically older, they have macular degeneration and other sort of conditions that, they're essentially legally blind. They have very limited, they're not completely blind, but they're very limited, eyesight. And so, these virtual reality goggles, right, which are used by gamers and, VR, aficionados and so forth, they're being used tied with a camera to provide, basically perfect vision for people who are using these devices, right? And it's just such a massive change in their lifestyle, right? And it's not just that, but, there's other things that you can do with that. Again, these are potentially connected devices that can, provide information to the caregivers, can potentially be used to, send entertainment and so forth, etc. So that's a big one, digital devices for healthcare. Another big trend that I see is data analytics for healthcare, right? I mean, as in everything else, I mean, it's a little bit Orwellian and scary as well, but there's lots of fantastic, outcomes that healthcare in particular is seeing from that. And I think we're just starting to see that, right? As more and more of our lives become digitized, data and machine learning is being used to predict outcomes, and fine-tune treatments, right? So, for example, we're, one of our clients is a genetic testing company. They have labs all over the world. And when COVID happened, they kind of pivoted to provide genetic testing to test for COVID. And we're helping them take all of this digital data. There's massive amounts of it. It needs to be cleaned, standardized, and then reported to national and state health authorities so that experts, both machine experts as well as human experts, can use this data to, provide sort of, point of care, essentially, predict where disease outbreaks may be and provide, policies and so forth for controlling COVID and other diseases. And I'll give one more example, which is, we have, again, a company in our portfolio at Mentis Fund, Akero Labs. They're using, so a lot of this data is siloed, right? This is a big problem that data analytics and machine learning have across the board, not just in digital health. So data is held by healthcare systems, by public health authorities, by police departments, by, fire departments, et cetera, et cetera, et cetera. Akero Labs has very successfully gone and unified a lot of this data. It's building this platform with data from like hundreds and hundreds of sources, and it's presenting it in a queryable, standardized format. And so again, this data can go back to state, to national authorities, to healthcare chains, to do things like prediction of, disease outbreaks and so on, and the actions that come from it.
Yeah. Please continue.
The last sort of trend I'll talk about is that as with the rest of the industry, it's all about the cloud, right? In particular, over the last 5 months with COVID, businesses have been forced to work remotely from home, including doctors, dentists, healthcare professionals. And they've been looking for tools to be able to operate, right? So things like, intake forms, if there's an on-premise system in a doctor's office or in a clinic or a hospital, that's fairly useless, for if you're doing remote consulting. So there are web-based tools for scheduling, for billing, for intake, for EHR. And a lot of people have started using, bits and pieces that are easy to find and easy to set up with just a little bit of tech stack, right? And that's a big trend, right? And, we at Folio 3 have come up with a solution called Clinic Ally, which just puts all of these things together under one umbrella, very easy to use, that we've seen some really good traction with. And so with the rest of the industry, just the ease of use, the ubiquity of being able to use cloud solutions is just a big trend in healthcare as well.
Yeah, absolutely. Not only, I guess, this is across, the whole, a lot of industries now need to really switch, all accelerated by COVID. But I 100% agree with the cloud as well. Those were really great example and, really opportunities for healthcare, but I think the picture isn't full if we don't talk for a moment about the challenges.
Yeah.
And it feels to me that the big challenge that has to be addressed is the financial impact of COVID-19. And for providers, it's really dramatic. So hospitals have been put in incredible difficult situations. So they had to ramp up their performance. They definitely had to ramp up their testing efforts. The places that are in a hot zones, the hospitals that are in the hot zones, the doctors and nurses needs to be treating really seriously ill patients. Many required specialized equipment, many required PPE. And at the same time, they need to ensure minimal spread of a highly contagious virus. And all this really required the specialized equipment, yet at the same time, the virus disrupted the supply chain, so making the deliveries longer and more expensive, especially at the beginning of this outbreak. So, on the cost side, the cost side have continuously been growing, yet at the same time, the revenues dropped so significantly. And everyone is talking about the airline industry, but yet hospitals' revenues are following very similar trajectory.
Ironically, just given how many sort of, patients are out there. Yeah. Yes.
Exactly.
Very true.
Yeah. But like all non-elective procedures have been canceled. So, no one is going for that because no one wants to get exposed. Patients are delaying care. Even myself, I needed to see optometrist and I delayed as much as I could. So this is really staggering. So, I think AHA estimated that health systems are losing something like 50 billions with a B per month. At least that was the very first few months of pandemic. That's the situation. So it's really, the pressures are terrible. And on a payer side, so on insurance side, it is slightly better these days. But, we don't know whether there's not going to be a knock-on effect of COVID-19 and, the fact that 56 million Americans actually fight for unemployment. And with, insurance tied to employment, it might not be, there could potentially be big impact on the payers, so health insurance as well. But you know what? So these are new things, but then they also mount on the trends that actually have been happening for quite a while now, which is pretty much the increased share of patient financial responsibility for their health. So previously, it was, I want to say, something about between 5 and 10% of providers' revenue that was coming from patients. Well, today it's over 20%. And so this means that the average patient for average patient the costs really skyrocketed, and sometimes they're really unable to pay, or they really need to figure out how they're going to navigate. So JP Morgan and Instamed, they provided this study earlier this year saying that I guess 9 out of 10 patients were surprised by their medical bill in 2019 alone.
That includes me.
Yeah, same here, yeah. And then a few years ago, we did our InfoEdge study about patient payment preferences. And what we discovered is there's a big percentage of people that had to put off care at least once, but especially for among the lowest earning households, 1 in 3, so 33% of respondents said that they had to plan every single healthcare visit based on their financials. So they were really putting in place the healthcare, the financial health above the physical health. So that's very sad. So anyhow, when you see this, you see that the providers are in a really challenging spot, because now they need to collect on this higher portion of their revenue from the patient. Again, still a lot of providers are relying on maybe manual work, maybe, frequently it's paper-based transactions to collect. And, not only this is more expensive, but it also could potentially be inaccurate and resulting in medical bill errors and, even more dissatisfied or confused patients. So the work that we did with one of the really large health systems here in the US was to exactly minimize that. So when you think, so really thinking very broadly on how to revamp the patient payments. So broadly speaking, we help our client build the strategy as well as business case. So really estimates what are the benefits of a new solutions. Like we also comprehensively looked at all different solutions and tactics that could be put in place to really decrease the bad debt as well as increase the revenue. So think about things around flexible payment plans and providing the patient this peace of mind that, hey, we're not gonna send you, $10,000 bill all at once. We'll work with you to make sure that you have a means and solutions to pay for it. But also, things around. We were also looking at all sorts of strategies to really decrease the cost, and say by moving patients to let's say cheaper tender type, or providing cost-effective collection and payment channels. So I think that's something that I think especially hospitals, which are right now really struggling, could they need to be thinking broadly on all sorts of revenues and costs that they are incurring. What are the challenges apart from that you observe, Adnan?
Yeah, I think costs is clearly the biggest challenge that I think the system is facing right now. This huge revenue shortfall, and the good news is there are lots of entrepreneurs. There's lots of people looking to find solutions to that, and there's a lot of energy sort of going into that. And this is an area where technology and automation can help, right? I think that's a big. I would say that's the biggest challenge, right? The other challenge is managing remote care. As we said, that's a big trend. I think everybody's seeing that. Everybody's starting to use it. A lot of conditions can be handled remotely much better in some cases, right? And finding a secure, comfortable way for both the doctor as well as the patient, to use it is I think another challenge. As we sort of see this wave coming, just making everybody comfortable with that. So let me so give you a couple of examples of what I've seen, where both of these challenges are being met by some of these entrepreneurial energy that's been unleashed. So one of our portfolio companies is provides a service called Phambly, Phamily. And what they do is that for chronic care management, right? A lot of doctors would have their nurses or themselves, call up their patients on a periodic basis, monthly or weekly, and talk to them or bring them into the clinic. Now that's, extremely sort of, expensive labor, if you will, right? That is going into doing those follow-ups, right? So what Phambly's done is they've created this platform, software platform with algorithms, right? Based on the condition, whether it's diabetes or Alzheimer's or something else, there's text messages that go out to these people. Text messages are the most ubiquitous, most easily used, way of communicating with people. Almost everybody knows how to deal with that. And so, they receive, let's say, a weekly text message. Hey, how are you doing? How are your vitals? What was your blood pressure, blood sugar, etc. They respond, right? And then an algorithm essentially, right, creates a response to that. And a lower skilled worker, somebody not quite a nurse, basically, makes sure that is following the protocol and just sort of releases that response. So that level of care, that consistency of follow-up is there. Now, in cases where, the algorithm, does not know how to deal with it, or, there's clearly some attention required from a doctor or nurse, then, that's the exceptional path that is taken, right? But as you can imagine, for these types of things, 80-90% of the interactions can be taken care of by a combination of algorithm and lower skilled human. So what's the result of that? Dramatically decreased cost, right? The reimbursement is the same, right? But the cost is dramatically decreased, and therefore these businesses can continue to function as viable businesses, and continue to invest in the areas where they need to invest. Another example of that is with Folio 3, my company. One of our clients provides acne treatment, right? So you go to their clinic, they'll kind of they'll check you out, and then there's a protocol that you go through, and periodically you have to sort of either come in and be examined, or send pictures, videos, etc., based on your condition, right? Again, with COVID, coming in, there's big challenge, revenue shortfalls, etc. And the good news is that the system that we provided them, this clinic management system, allows them, their people who used to come to the office to work from home remotely, do scheduling, billing, intake. There's customized intake procedures where people can simply just upload their pictures from a mobile app, for example, from a mobile phone, etc. Follow up. There's a telehealth component to it as well. So all of that, under one umbrella, and they're able to function as a business. They're able to provide the services that people need, and do that in a cost-effective, efficient way, using remote care in a very safe and a comfortable environment, right? So even apart from COVID, just think about it, right? I mean, going 10 times to this clinic, right, maybe half an hour away, versus being able to do 7 or 8 of those visits online, and being able to, the staff being able to just kind of handle everything from home, right? It saves tons of time. It makes a lot of sense. And because of COVID, the silver lining of COVID is these technologies are coming to the fore, and the cost savings that they're putting in place, I think, will be a permanent feature of the healthcare system going forward.
Yeah, absolutely. I agree. Like, a lot of those trends are here with us to stay. But building on a few things that you said, I actually had a chance to observe and support, and we pretty much facilitated an assessment of big data analytics, as well as some digital health applications in really large health system, over 100 hospital strong health system. It was our client, and we helped them with an overall framework for to evaluate exactly what you just said. So mind you, when you vet big, you have to think a bit more cautiously, and also you're dealing with life and death situations every day. So maybe the risk might not be as open as other smaller organization would have. So we worked with them to actually come up with a full comprehensive framework to assess various digital health technologies, and yeah, as I said, like you'd be surprised how thorough and comprehensive such assessments have to be before you put them in place, even for a pilot at the larger organizations. And so you need to look at so many different things. So you look at the following. You need to look at obviously frequency of a problem, but that's obvious. You need to look at the severity and potential business case, whether there are cost savings. And as you said, I can't picture it to be any other way. Like most of the time, it is cost saving from the physician time cost standpoint to for also member or patient experience, right, is also very important. But large health system also needs to look at things around whether there is a broader digital health strategy, and did all our business partners and stakeholders really align to this, and is organization across the board, they have the same willingness and appetite for experimentation. So we definitely had lots of interesting conversations then. We also were looking at what's the current infrastructure. A lot of health systems have some issues with legacy technologies. So another part of evaluation was how flexible is the infrastructure, and do you have a technology stack that is expandable to those new technologies? So that's another important thing. But another big success factor in this case were things around marketplace readiness. When you're a health system that is 100 hospitals, when you're so big, you probably don't want to go with one very small solution. You want to go with someone that already built something and proven something. So marketplace readiness was actually very, very big. But definitely not least was clinical staff adoption. So that's another thing, right? Like as great as a lot of those technologies are, and and they are all great, but you really, when you're that big, you really need to think forward. Like, okay, do we have clinical staff buy-in? If not, how do we make sure that we will get this clinical staff buy-in? What's needed for that, and so on and so forth. So a lot of this change management work has to be put in place to actually succeed, even with smaller pilots, because clinical staff is absolutely major stakeholder in those solutions. But I agree with you. I feel like a lot of those solutions are really great, and I hope they can get implemented very quickly. And a lot of them are here to stay with us even post COVID-19. But considering,
I would say that all of our companies, we advise them to start with the smaller sort of entities. So the clinic, the smaller practices, etc. And that's where they're seeing a lot of traction, right?
Yeah.
And obviously, you kind of, as you said, that's where they prove market readiness, and then they sort of work,
Absolutely.
But that's the way to go, and I think these are the technologies of the future. I mean, I think these are the technologies that will deliver those big cost savings, and honestly, just much better level of service, right, to the patients and to the hospitals and clinics.
Do you see anything else? Like if you were to predict, any other prediction about the future that you'll have, any other thing that you see happening?
Yeah, I mean, I think some of the things that we talked about, I think, if sort of looking into the future, remote care, I think, will be a much bigger deal, and I think that will become much more adopted just because it makes a lot of sense, right? The market itself is recognizing that. I mean, recently we heard about the acquisition of LiveOnGo by Teladoc, right? So one is providing telehealth solutions, the other is providing remote care and this monitoring and devices. And it just makes sense to have, a company focused on remote monitoring and care, right? So that's clearly sort of, a market recognition of that. And a lot of these services that I mentioned, and there's plenty more in the Mentors Fund portfolio, are sort of, taking advantage of this trend. The other thing that I see and predict is that data analytics is just going to be much, much bigger, right? And there's a number of things where I think data analytics makes sense. Predicting outbreaks, as we've seen, with this genomics testing company and with, Akero Labs, which is providing all this unified data so that, it can be used But frankly, better follow-ups, right? Chronic care, like with the Neuroplan or Live On Go, or some of these other the acne treatment company that I mentioned. It's not just sort of better follow-ups, but algorithms are now coming out. They're looking at things like environmental factors, like allergen information, like the weather. It's a very hot day here today, and that can mean certain things about certain conditions, right? Which may not be, unless you're talking to your doctor every day, you may not get that information. But a system like Family can actually provide you that information. Hey, watch out, A, B, C, D, right? And then again, we've already seen, and I think this trend will continue, radiology data, right? We've seen that algorithms and machine learning systems are, in many cases, doing a much better job than humans in terms of being able to detect cancers and disease, et cetera, from various radiology data. So those are the two big trends that I see in healthcare, right? Remote care, including telehealth, and then data analytics and all the various things that it can do.
Yeah, and I'm glad you're mentioning the data analytics. It actually has been a bit a big focus point for this 100 hospital strong health system that we've been working with. It's exactly like you said. So they did recognize that right now they use the data. First of all, the data is fragmented, like you mentioned, and they recognize that at the moment we're using the data in a very retrospective way. So like, okay, what happened? How did it happen? Things like that. But what we built with them together was, okay, how then do you move from looking at the data retrospectively to how do you then build the capabilities? A lot of it's tech capabilities to start looking at data real time and analyzing data real time. And then moving forward, just like you said, how do you then, what's the framework to make the next step to this predictive, to using the data in a predictive way? So how do you predict diseases and so on and so forth? So yeah, that's another big thing. I think on everyone's mind, but it's still a few years out there before everyone can succeed. But building on some of your trends, I actually also agree with you. You mentioned consolidation. I think consolidation will be another big global trend that we'll see in healthcare. And it might be, something more surprising than what we've been seeing so far. It might be between maybe tech players and health providers, right? So I'm pretty sure we'll see some interesting mergers and acquisition happening. But another thing, and this is, because we as patients are more and more responsible financially for the health. I think another big trend will be consumerism. And a lot of organizations we're talking to, they are now beginning to recognize patients as consumers, which hasn't been the case, right? Like previously we were like, okay, this is my payer, this is my provider, I'm going to stay this way. But now more and more the organizations that I talk to, and I really encourage the organization I work with to think about it this way, that it is your patient, but start thinking about your patient as a real consumer. Because it requires some sort of shift in how you're doing your operations. And then, so consumerism will be big. And then I feel building on this consumerism, I see this, for me, it's very optimistic future. It's when healthcare is, building on everything you discussed. So like this more remote devices, this, all the different sensors that allow this monitoring. I think it's possible that one day our time as a patient, as a consumer, will be so valued that we will be meeting healthcare way closer than a health system or a clinic. I'm almost seeing it like, we've seen during COVID-19, the testing was done among communities. So health systems put out tents within communities. I wouldn't be surprised if maybe in the longer future, we will be seeing similar things, that there would be some sort of a mobile lab or mini clinic. Maybe it's even self-driving and it just drives between different neighborhoods and it really takes care about the patient time. So instead of me going to the lab to have my blood drawn and blood work, maybe I just go downstairs and, in the office, whenever we go back to the office, finally, down in the office or somewhere where there is a mobile mini clinic or lab. and it's so convenient that everyone, and at the same time, hopefully via digital technology, so cheap that everyone can afford and everyone has a good car.
Yeah.
So
I think consumerization of software is a much larger trend that we're seeing in other parts of of our lives as well, other parts of business as well. And ultimately, it's about sort of empowering the consumers, right? They have a lot more choices, a lot more options, and they're kind of demanding that they be able to deal easily with all the offerings that they'll be given. And I think ultimately that's good for businesses on the other side as well, because you have much more engaged clients, right?
Yeah.
Who you can serve in a much better way, and therefore be able to charge for the level of service that you're able to provide.
Yeah, absolutely. Yeah, but that actually has been such a great discussion. But I think it's time to wrap it up. So if Adnan, if people would like to learn more about you and Folio3 and the work that you're doing, what's the best way?
I would encourage you to look up our website. So Folio3, FOLIO3.com, or digitalhealth.folio3.com. We have a recently launched digital health practice where we're doing lots of exciting stuff. Or look me up on LinkedIn, or look up Folio3 on LinkedIn. Also, Mentors Fund, some of these fantastic companies, look up mentors.fund. And, a lot of these companies are mentioned there, and I'm sure you'll enjoy finding out about them.
Cool. Very cool. So similarly, you can find InfoEdge on, by searching InfoEdge LLC. So you can find us on Google. You can find us on LinkedIn. Again, search for InfoEdge LLC. And also feel free to find me on LinkedIn and connect with me. I'd love to connect with our viewers. Adnan, thank you so much for joining me today, and have a great rest of your day.
Thank you so much, Bella. It's been a pleasure.